Welcome to Educationally Speaking. My name is Sarah Davis, and I'm a communications specialist with Oakland Schools and the host of this podcast. The goal of Educationally Speaking is to focus on important topics related to education here in Oakland County, Michigan. Today we're going to talk about a joint partnership between Oakland Schools and the Oakland County Health Division, which was created in June of this year as a response to the public's concern about how to keep students and teachers safe when school resumed. This partnership, dubbed the Oakland Together School Nurse Initiative, led to the hiring of 68 nurses who have been deployed to school districts throughout Oakland County and provide public health strategies and direction to staff and students with the goal of stopping the spread of COVID-19. Here to talk with us today about this partnership is Calandra Anderson, who has held various nursing positions at local hospitals since 1994, and in 2019 transitioned to working as a public health nurse for the Oakland County Health Division. Today, she is the Quality and Process Improvement Supervisor at the Oakland County Health Division and acts as manager of the nurses who have been hired under the Oakland Together School Nurse Initiative. Welcome to the show, Calandra.
Thank you. Thank you for having me. I'm excited to be here. This is such an important topic.
Awesome. And representing the Novi Community School District, we have Cathy Farris, who has been the district's nurse for 10 years. She is also region leader for Oakland County Nurses and vice president of the Michigan Association of School Nurses. Welcome to the show, Cathy.
Thank you for having me. This is a great topic.
So, Calandra, I know I gave a brief overview of what the Oakland Together School Nurse Initiative program is, but could you go into further detail for our audience?
Absolutely. So in July of this year, more towards the end of July, I was asked by the Oakland County Health Division to support the reentry of schools for K through 12. And what that really entailed was hiring seasoned nurses within Oakland County and surrounding districts to play a major role in the fight against COVID-19 within the school system. I was very honored to be a part of this program, and we journeyed to find nurses that would be interested in becoming a school nurse very quickly. And so we have talent from all over Oakland County, as well as surrounding districts that are a part of our COVID nurse program. We quickly gained momentum in hiring nurses that wanted to add to the support of schools. A lot of our nurses are coming from hospital systems that are working full-time jobs in addition to being a part of our school nurse program. As you can imagine, school nursing has not traditionally been something that Oakland County has done, and we do have district nurses. However, we certainly don't have enough nurses to cover all of our school systems. So this was very important and very impactful for schools. We were able to hire our nurses, and we needed to quickly work with our district nurses who really, we are following their direction. They've been out there within the school system. They recognize the challenges that are happening within the school system. Outside of COVID, we still have issues in schools with students who have other health issues, including health problems like diabetes, asthma and allergy, and seizures, just to mention a few of them. So we partnered first with our district nurses to find out how we could support them within their districts. And then we focused a little bit on COVID. All of our nurses were given access to the Michigan Association of School Nurses that was paid for through the grant, the CARES grant, to get them the foundational information on how to perform as a school nurse. We felt like this was very important, coming from hospital systems and school nurse or long-term care facilities where they had not been acting in the capacity of a school nurse. So it was very exciting to work with our district nurses to learn a little bit about what it looks like to be a school nurse. And then what we wanted to focus on at the Oakland County Health Department was quickly bringing these nurses up to speed on how to respond to positive cases within the school system, understanding a little bit about the basics of COVID, and how to be great communicators and building trust within the school system as we move forward to support them in the reentry program.
Excellent. So what exactly is the role of the nurse? I think a lot of people sort of envision the nurse as someone who hands out a Band-Aid, if a child has an injury on the playground, but there is so much more to the role that these nurses are playing right now, correct?
Absolutely. With the understanding that there have not been nurses in schools traditionally, we really looked at how could we impact schools on a temporary basis. The CARES grant allowed us to hire nurses to work within the schools on a part-time basis, and the grant goes through December the 31st. So we thought, what could we do during this short period of time to assist schools and school officials? And with that in mind, we developed a program where the nurses are there to educate the folks that are already designated within school system to perform various activities that a school nurse would typically perform. So we're looking at policies and procedures. We're looking at 504 plans and IEP plans to make sure that it encompasses everything that will keep a student safe in school and to help guide the folks that are already designated to perform those activities in school. We're also acting as communicators. And so we're working between superintendents, we're working between the principals at the building and all of the frontline staff within the school system to educate them about COVID-19, to show them how to use our website, to focus in on the things that are going to be very key to them as students begin to return to the building and as teachers as well are returning to the building. And so again, it is really working on a trusting relationship to provide them the education and the training necessary to respond to positive cases of COVID-19, as well as to respond to students who exhibit symptoms of COVID-19 while they're in school for the school day.
Okay, so once these nurses were assigned to their respective districts, what were the first few tasks they were given?
Great question. So most of the schools in September were not face-to-face. And so we had a great opportunity to do some training before students actually were in the campuses. So our great group of nurses, in conjunction with our district nurses, were able to put together a checklist. And that checklist is mostly a safety checklist where we're doing walkthroughs at the school campus to show them, to help them make their decisions and their emergency plans around returning students to school. And what the walkthroughs look like is we're looking at their onboarding and offboarding of students, whether they're coming from the bus or whether they're being dropped off. If they have a good plan for being able to social distancing students as they transition into the school building. We're looking at signage throughout the campus to make sure they're reminding folks of social distance and the importance of social distancing, as well as the importance of good hand hygiene and is being practiced frequently within the school district. And most importantly, we're focused on compliance with masks and providing recommendations around mask wearing and following those guidelines. We are also taking the opportunity to look at their classrooms and their ability to social distance within the classroom, use protective barriers like partitions in between students and between teachers. We're looking at their ability to cohort students because we know based on the governor's roadmap, as well as CDC recommendations, cohorting students will minimize risk of exposure to additional students in the classroom. It also provides a great way to be able to contact trace when there's a positive case within the school system. We're looking at their lunch periods. How are they going to do lunch through cohorts? And we're looking at for recess, are students staggered in? What are the dismissals looking like? Are all students dismissed at the same time, congesting hallways, and providing great recommendations on how to get past some of those things, how to put some best practices into play. The great thing about working with all 28 districts is we have an opportunity to look at what schools are showing best practice in terms of their ability to cohort students, as well as to keep them socially distanced during the school day. Those are some of the things that we're looking at. We're also focusing in on their health screening. The Oakland County Health Department Schools Guidance does not recommend universal screening. That means all students being screened at the point of entry of schools. We put together on our website for K through 12 schools some templates that schools can adopt to assist them with students that need to be screened. And if they choose to screen, we give them great recommendations on how that screening station should be set up, including the proper PPE, barriers, supplies and equipment that will be necessary in order to perform screening upon entry. However, we also recommended and provided templates for schools to be able to adapt, which is an agreement or an acknowledgement letter that parents would screen their children at home and keep students home that are exhibiting signs and symptoms of COVID-19, with additional recommendations to contact their medical provider to see if testing would be recommended. The one major thing that we are working with schools is their isolation room. And this is the room where children that are exhibiting signs and symptoms of COVID-19 would need to be separated from healthy populations of children until parents can pick them up. And so we're helping them to identify an appropriate room that has a bathroom that is specific to students that may be ill, and restricting those areas to those ill students, and what type of PPE is required for the folks that will be monitoring students in that room. We've gone so far as to create guidelines for the isolation room, which includes what supplies will be needed for that room, what type of documentation should be captured when students are brought to that room. And we've provided a parent letter that could be sent home identifying what symptoms that student would have and what recommendations we have in order for that student to return to school. So we're really excited about the work that's been done. We've essentially built this program from the ground up, and the nurses, including our district nurses, have been very supportive in putting together clear guidelines and recommendations that are going to support schools as students return to the classroom.
That is a lot of moving parts. Very impressive how you have been able to put all this together and in such a short amount of time too. And on top of that, the nurses are helping to educate staff, correct?
Absolutely. It's really important to help as much as we can educate and communicate the facts of COVID-19 and the recommendations of the CDC. As you all may be aware, recommendations change over time. So our school nurses are working directly with the front office staff, which is mostly sometimes the secretarial staff that are receiving the calls from parents, concerned parents. And so we are definitely working with them to train them on basic COVID, to dispel any myths that they may have about COVID, and really focusing on the prevention measures, which is the frequent hand washing or hygiene, the ability to social distance, and compliance with masks. And so we've had a very, very warm reception in all 28 of our districts in supporting them. And we continue to answer any questions that they may have. And I think that we have built trust very quickly with the school system, and that's something that we all can be very proud of.
Okay, so let's bring in Cathy from Novi to talk a little bit about this. Cathy, you are actually not part of the Oakland Together School Nurse Initiative. As I stated before, you have been a nurse with the Novi Community School District for 10 years. But this is actually very rare because in Michigan, we rank 50th in the United States for the number of nurses in schools. There are actually only about half a dozen in Oakland County alone, and most work part-time. So when you first heard about this new initiative, what were your thoughts?
So my initial thoughts were I was a little nervous because I wasn't sure what it was going to look like. And when I was told that they were just going to be here for a short time, it made me even a little bit more skeptical about what could I do with them and how could they be successful and how are we all going to be successful together. But then the very first day they started, I was like, oh, this is awesome, because they were helpful and knowledgeable and eager to help, getting us in school. And we were in a unique situation because we were one of the only schools in Oakland County that were going back face to face. So we are currently a hybrid model, and we have virtual. So we're about 52% virtual and 48% hybrid. So right off the bat, I mean, we were starting school the first day of school, and they were so helpful, just helping me navigate. Well, what do we do? We got to train staff. We have to get our isolation rooms intact. We have to look at masking. We have to look at lunch. We have to look at recess. And they were on top of everything as quickly as I was on top of it. And so I was so appreciative and so thankful that they were here. And I'm going to miss them dearly if they ever leave me. But I was really, really happy for the additional help.
All right, and Calandra listed a bunch of ways that the nurses are supposed to help out at the district level. What are some key areas that you felt they really helped out in at Novi?
So initially, we kind of took, like the first week of school, it became a little overwhelming because we have 10 physical buildings that we have. And so we have 5 elementaries, we have a Meadows, which is a 5th and 6th grade, and a middle school and a high school. And plus we have athletics, plus we have a preschool. And so it was a little overwhelming to me what were we going to do the first week of school. So being that I have 2 nurses, we kind of split the district up, and we're responsible for kind of some buildings that if they needed immediate assistance, we would be physically in that building at some point of the day. And that was really, really helpful, that if a staff member in the front office could see a person physically, they were much more likely to ask questions right then and not feel like they had to take time out to call them or email them or do whatever. So that was very, very helpful as splitting the district. But as soon as we got in there, we were recognizing things that we needed to do a little bit better. Like we had to make sure that classrooms were 6 feet apart. So we were walking around to look at those things, looking at kids' masks and making sure that they wore the appropriate masks to be in school. Some other things were the training. We would have trainings almost every mornings for staff and staff meetings, and they were able to ask questions. And with 3 of us on a panel, there was a lot of knowledge given to that panel, because some of the questions I didn't know if it was, some recommendations from Oakland County, we would kind of learn that together. And so having them there and being the advocate for Oakland County Health Division was a godsend, because they knew sometimes those rules where I didn't know those rules and facts 100% like they did. So that was really, really helpful.
Right, or you would have had to take time to contact them probably and find that out versus just having that expert right there standing right next to you to have the answers.
Correct, and it was nice that they would have the contact at Oakland County that we would, because unfortunately we had some positive cases, and then we would have to report, and they were kind of that middleman of, hey, where's the report sheet that we have to do? We just had to find that together. And so it was really, really helpful to have just kind of a team, and our personalities are really great together. And so we're having a lot of fun doing it too. So that's been very helpful. But I've been very, very thankful for this program. So.
Awesome. So Calandra, have the nurses been reporting back on what areas they are most commonly being asked for guidance on?
Yes. So I think the biggest issue that schools are really struggling with is cohorting students and trying to meet the 6 feet mandate. We recognize that schools are all different sizes and shapes. Some schools are larger and doing a very good job with the 6 feet distancing within the classroom, but that's not the case with all schools across the districts. And in the event that a school is not able to get 6 feet within the classroom, we are providing recommendations, more so focused on the ability to cohort, the importance of keeping seating charts, because if any student tests positive, we'll have a great way of being able to do our contact tracing and identifying students that were within 6 feet for 15 minutes or greater of a positive student. And so I think that is probably the major concern across most of the districts is if you cannot maintain 6 feet, what recommendations does the Oakland County Health Department and the school nurse program have in order to keep them safe in the classroom? That seems to be one of the biggest concerns. The second concern is around symptoms. And we know flu is on the rise, and flu mirrors a lot of the signs and symptoms of COVID-19. And how do you determine whether or not a student has the flu or if a student is actually positive with COVID-19? And so we're providing recommendations. We're working with the recommendations through the American Academy of Pediatrics and our epidemiology world. We know that the CDC will continue to provide guidance as flu season is upon us. And we're recommending, of course, that students still receive flu shots this year and to keep them safe from contracting the flu. But we're also recommending that parents keep students that are ill at home. One of the things that we wanted to do with this challenge, the Oakland County Health Department has partnered with Beaumont Health System, and they've created a referral line. And what that means is that parents between the hours of 5 a.m. and 8 a.m. can call this line and speak to a live person, a health professional, and ask those questions that they will be asking at the school level. My child woke up with, a specific symptom, and I'm not sure if this is a symptom of COVID-19, and I'm unsure of whether or not I should send my kid to school. The folks at Beaumont are answering these calls, and they're providing recommendations to parents that is consistent with the guidance that has been given by the Oakland County Health Department. And I can tell you, we just started this on Monday, and we're getting some great questions from parents across multiple districts. And we're providing the guidance to keep unhealthy kids home and not put them into the healthy population of kids that are returning to school. So I would say that answering questions about symptomology and whether or not a kid should return to school or come to school on that day, we're capturing some of that. And I hope to see more momentum with parents as we get this information out that they have this avenue. And we use 5 a.m. to 8 a.m. because this is the time that a lot of parents are getting up in the morning, getting themselves ready for work, and also getting their children ready for the school day. So we felt like this was a great time to have this line open. However, after 8 a.m., we do have nurse on call at the Oakland County Health Department, and parents can call our nurse on call, and they're there Monday through Friday and for some hours on Saturday, and ask these same appropriate questions and get some support and guidance in whether or not students should return to the classroom for that particular day.
Okay, what are some other places the public can get more information and resources as it relates to COVID-19?
We've done a really good job, and we continue to edit our website to provide as much guidance as we can. We're also providing guidance on music therapy in schools, the mental health of students, athletic program guidance. And so our website is pretty robust, and it continues to grow. Our website is www.oakgov.com/COVID. Here you can get a lot of the flowcharts that will help guide decision-making on whether or not a student should report to school. There's a decision tree even for folks that may have been exposed to a positive person and what those recommendations are. We also have a lot of information and scenarios in our FAQ section, as well as our document for quarantine guidelines and how often should a person quarantine. We have recommendations on our flowcharts regarding if you are tested positive for COVID-19, how many days that you need to be home, what is the infectious period for that as well. We have screening checklists, and all of the symptoms of COVID-19 are updated on our website. So we encourage the public to take a look at our website. And then we have a full document, which is our full guidance document that talks more about prevention measures, monitoring measures, and also testing. Parents can find on our website information about how to get their child tested through the Oakland County Health Department for COVID-19, which is free for any Oakland County residents. We recently opened up our drive-through site to be able to test kids 4 years old and above because of the reentry of school. This is something that we did not have before. It was 18 years and and up. And so now free testing, we do COVID-19 testing 5 days a week at 3 locations. It is by appointment only. However, we expedite for any children that need to be tested for COVID-19.
And how can these parents find out who their school nurse is and get their contact info?
Yes, that's a great question. The school nurses update their COVID designee at each school weekly on who is available to assist them. Our school nurses also have taken part in parent meetings in conjunction with the school. They have been introduced at the school board meetings in most districts. And so a lot of the districts are already aware, the parents in the community are already aware. But I do want to mention when we begin to hire nurses for these districts, we took into consideration that many of these nurses may have children within the district. And so we thought it would be a great idea to offer them a preference to work within the district where their children attend school. So some of these nurses are already on their the parent committees within the school. They're very well known within their districts and have relationships already with some of these school officials. And so we think that that is truly a bonus because they're not only working from an Oakland County Health Department nurse perspective, but they're also working in the perspective as being a parent within the district. And I think that that goes over very well with the buy-in with the community. So we're really, really excited about that, that they've taken the opportunity to work within their district.
Okay, that is very interesting. And Calandra, do you have the phone number available for the Beaumont referral line?
Yes, I do. The number to reach the Beaumont referral line is 248-551-4242. It is open between 5 a.m. and 8 a.m. Monday through Friday between now and December 30th. This is at no cost for parents or guardians of children, and this is specific for Oakland County school-aged children. After 8 a.m., the community can call our nurse on call at the Oakland County Health Department. That number is 1-800-848-5533, and it is open from Monday through Friday between 8 a.m. and 6 p.m. and 9 a.m. to 12 p.m. on Saturdays.
Excellent. Thank you so much. And for our audience, we will have all of that information in our show notes so that you can follow up if you need to. Thank you, Calandra and Cathy, for providing your insight on this valuable program. Also, thank you for all that you've done to work hard to keep our students, teachers, and administrators safe. I think we can all agree that the work that is being done by the school nurses in the districts is just invaluable, especially right now.
Thank you.
Thank you.
This podcast was brought to you by Oakland Schools Intermediate School District's Communication Services and is produced by Media Production and Distance Learning Manager Mark Hansen. Oakland Schools is a regional service agency that offers support services to school personnel which are better delivered regionally and provide cost, size, and quality advantages to those we serve. You can find more information on Oakland Schools at oakland.k12.mi.us. I have been your host for this podcast, Sarah Davis, and you can find this and future episodes of Educationally Speaking on Anchor FM. We hope you will join us for our next episode, where we will continue to bring you topics that affect every student, every day.